Thank you, Matt, for your introduction. Assalamu alaikum, good morning. Thank you for your attending. Without you, I can't do anything. I will be like a crazy man to speak alone. And it means important that you are here. My talk is mainly to share with you some thoughts. Perhaps after you will have some questions about some concept of responsibility, of acceptance, taking care of patients, treatment, to help them to go back on the field, to have the same or pre-injury level, to speak about some sensible cases. Mainly it's about injuries, long injuries, and specifically about ACL and shoulder. You are all experts in your domain. I want to talk slide by slide and to come into some concept. It means when the injury happened, we can see many series of expressions. We have physical expression, symptoms. It's very clear. It means as an expert, you can recognize, you can know this kind of expressions, and we are requested to work on it and to help the patient. It's pain, swelling, deformity, weaknesses, stiffness, instability. This is our language, common language. And we have another language. Perhaps it will be more not visible like the first category. It's psychological factors or expressions of something happened in the life of the patient. And it caused the patient or the athlete is struggling with some issues in his mind. And sure, we will see some this kind of expressions, the shock, his traumatic event. We can see anger. It means see when you have discussion with the athlete, if he will feel confident with you, he start to speak about his mental issues. We can see irritation, sadness, isolation, lack of motivation, confidence, lack of confidence, frustration, changes in appetite, sleep disturbances, and disengagement, and lack of self-esteem. All these kind of expressions are important, the same way, in same category of physical symptoms. But how we can deal with them? Everyone is expert in his domain, and he's doing his best to do his best to help the athlete to come back to his pre-injury level. And every single one here, he has a certain responsibility, but my main point is how to work together. We are doing this. How to improve our relationship, how to improve our inter-responsibility to help every single patient athletes to go back on his field. I have some evidence, just like introduction to underline the importance of psychological factors. In this study, it means knee self-efficacy scale, ACL return to sport, ACL quality of life, satisfaction are such important factors, psychological factors to help, or it's associated with positive return to play with the pre-injury level. And you have other factors. Actually, we are studying sleep in affecting athletes about their treatment and to go back on the field with some factors like stress, anxiety, depression, and sleep quality. And this is a study related to Aspetar. That's sleep quality 5. It means there is it's indication of poor sleep. And sleep hours should be more than 8 hours, but it's not the case. We have this kind of cases, and all together we are working on it with all specialties. This is just an introduction to our talk today, and I want to share with you our domains, how we are working and where we are working. Sure, we are working all together with the surgeon, physician, physiotherapist, fitness coach, coach, trainer, medical staff. For this slide, it's about our work within Aspetar. It means we are working in this program, Healthy Lifestyle. It means how to improve sleep, performance, healthy lifestyle program, mental health promotion. We are working also with this program, prevention program, it means to prevent about injury from psychological aspect, psychological disorder, drop in performance. We are also working on another program, treatment program, and this is our main goal. It means we are working with our colleagues from rehabilitation department, ACL especially, and we are doing our best. It means we are working with the athletes. It means we have local athletes, national athletes, international athletes, recreational athletes. It depends what is the need. It depends. We can take it in charge and to work with them. We are working with Aspire students. We are working with VIP athletes. Our main target is how we can help them. How we can help them, it means with these big categories, physical symptoms and psychological symptoms. And we have, it means we, basically we have the Monday. It's dedicated for assessment and clinical assessment. Every single expert is doing his best for ACL, for fitness, for nutrition, our colleagues, for psychology. It means we're working basically on sleep quality, sleepiness, insomnia, stress, anxiety, stress, fear of movement, readiness to return to sport. And we have another day, same, it means another day to work together but closely in meetings, and very important time to speak about some cases. We have surgeon Mr. Londro, Bart, Polyvius, Kate, Carla, Martina. It means sincerely, this is very good experience. We experienced this since many months before. And for this reason, I put this title, From Distributed Approach to Specialist Approach. What means? It means every single one here in Aspetar, we should to be aware about psychological factors. This part is too much important to help athletes to go back. Sure, we have specialties for knee, for shoulder, we agree, but psychological factors is something invisible. It's difficult to perhaps to detect as per the, if you can compare with the physical aspect. And our job during the Thursday is to speak and to find out some solution how we can help athletes to go back. And we are all talking between each other, and it's very tough period because we are asking realistic questions. Perhaps sometimes it's hard, but we are professional. We are here dedicated for athletes, and we are seeking for excellence. And it's easier. It means to speak openly and to share some thoughts and to give some recommendations. This is, as I mentioned, is within Aspetar. We are also working outside. It means what? It means after 4 o'clock. We are working from 8 to 4, and from 5 to 6, sometimes till 9 during Ramadan, weekends. We are working with the clubs and federations. We are working with coaches, with medical staff, physicians, with athletes, youth development, senior categories, with clubs, federations. And it's totally different. It means our goals is totally different. As we can see on the slide, we have the mental health promotion program. It means we are basically working on healthy life balance. We have to educate athletes. If there is any issues, we have to speak about it and to give some information and to help them to have to increase their culture. We are working also about program performance enhancement, how to improve their performance mentally. It means education and training, develop productive and positive environment, and performance mental skills and self-regulations. And we have another part, it's performance restoration. In case of injuries, how to recover well with techniques, mental techniques. We are working on how to improve your cognitive skills and interpersonal conflicts. Right now, we'll pass to another step. As mentioned, today, we will work together. We will speak about something important. It means this is a case, it happened to me. I will not say what is the town, somewhere I had an injury on my shoulder, left. I underwent a surgery, lateral jet, okay? As an athlete, I was practicing karate. I saw myself big champion. And in the same time, I studied at university. What's happened? What the injury happened, it means you feel yourself, it's like you are dreaming. It's not really a real fact, but it's an injury, you have to accept. For this reason, the concept acceptance is too much important to understand acceptance. We are dealing with patients, with athletes, and sometimes because we are talking with the professional speak, our professional techniques, and when we are dealing with them, sometimes they give to us some answers. Sometimes it's difficult to understand. I'm not saying that we are not doing a job. We are doing excellent job. But main important part, it's about how to detect in his language what's happened. He's talking about his knee. He's talking about his injury. But what is sincerely is saying is a patient we say to you, I have a pain. What does it mean? What it means? He has pain, but there is sometimes a message, hiding message. I need your help. I want to trust you. I have many questions. I'm looking for your answers, but I'm looking for your support. You have visible message and the invisible message. And this is the challenge our work as psychologists and to work with our colleagues. When this injury happened, as I mentioned, we have a series of expressions, mainly psychologically and sure, physically it's clear. I had subluxation, okay, of my left shoulder. I was looking for a hospital. I found out one. I was very happy to find out a hospital, but what's happened? It means that during my surgery, when I underwent the surgery, I felt everything. I felt the scalpel on my skin. I felt the pain. I started to hear the discussion between the surgeon and nurses. This is very, it's like a nightmare. It's like a bad dream in your life. This is my second trauma. The first one is injury. The second one is during the surgery. I didn't finish my history. After when I woke up, what's happened? Sensory for shoulder is painful. It's too much painful. When I started to shout, and after I was looking for help, and the nurse he came late. And what he said, listen to this. He said, you are not alone patient in our hospital. You have to be patient. We need to analyze his speech, it means what? It means objectively is right. I have to be patient, yes? This is how to say, this is administrative ideas. It means you are a patient, you have to wait. You are not alone patient in the hospital. Who is responsible for this? I have to accept to have pain and to suffer and to say, perhaps I need a psychologist to help me to increase or to improve my coping skills. What do you think about this? And perhaps the psychologist is, yes, it's true. You are too weak. You need to strengthen your mental. You are a very weak person. I'm sorry to say that, but you have to work on your mind. Or I have to say, okay, it's true, it's my fault. I should to shout and to say anything. I have to discuss with the psychologist. It will be the right person I have to discuss with. Or I will say, no, I will complain about the nurse. It's not normal. Normal is here to help me. You see, this is the point of patient. They are asking these kind of questions. And sure, after what's happened, you have a series of questions. Since you are injured, and after your surgery, and during the rehabilitation, what is my diagnosis? I'm looking for diagnosis. What's happened? How long will recovery take? What is the purpose of treatment I'm receiving? What should I expect during rehab? What alternative workouts can I safely do? What are the warning signs that I am getting worse? It means this is the right of the patient to ask these kind of questions. But you have two messages. We have physical message. It means I'm injured, please take care of me. And you have series of informations to say, please, I want to trust you. Please help me. In the perfect world, it means in perfect world, I can ask these kind of questions. It means tell me at what time I will go back on the field. It means what? It means it's like nothing happened badly. Everything will be good. Just I need this kind of answers. Please give me these answers. But don't forget, he is what he's doing the patient athletes, because since he was in his team, now he is out of his team. He's looking for a new team. The new team is to help him how to go out, how to go back on the field. It means we have to be careful how we respond to the patient. What is the way we are give him answers? It means just cognitive informations. You have this, or he's looking for support. He's looking to build a certain concept. Is trust. He wants to trust you. It means you have to be present and to understand his messages. My history, it's more complicated after my surgery and my history with the nurse. It means I learned from this history some lessons, and I want to share with you, mixed with my experience in Aspetar. Psychosocial reaction during 3 phases of sport injury rehabilitation. I will take this like baseline. Response to injury. It's clear what I mentioned before. It means you have a series of reactions. It means fear, anger. You are not satisfied. You feel yourself lost. You have problem of identity because you are a sportsman. You are an athlete, and something bad happened in your life. And response to rehabilitation. It means during my rehabilitation, this is also a bad history. It was just one physiotherapist, and this hospital is dedicated for high athletes, just to mention this. Okay, one physiotherapist, it seems more than 20 years, more than 10, 20 years. One physiotherapist is working with perhaps 5 or 6 athletes, and he's doing his best. What I have to understand, is it normal? That's what I need, just informations that he will apply on me, his knowledge, his experience, and I have to say, thank you. This is the best way. Or I'm looking for something else. For something else, the message is invisible. It means we are looking for support. We are looking to believe people, because these people will help you to go out and to go to your field. And this is too much important. It means what is our purpose? To be excellent, men. How to be excellent? Just to show that we are excellent because we are technician, very good technician, very good surgeon, physician, physiotherapist, nutritionist, psychologist, trainer, fitness coach. What we have to show when the athlete is injured and he's attending his sessions. Response to rehabilitation, it means the research, we can find some good information about just after the surgery. The patient is afraid a little bit to be re-injured again, to make a mistake about movement, and he's looking for your support. He's looking for your support. He's looking for your taking care of him. It means treating someone is just to apply our knowledge, experience, and expertise, or we have to build something. This something we'll speak after. And the last step, response to return to play or termination of career, this also is a very sensible period, because you have two big events. After surgery, you have high anxiety, too much equations, and before to go on the field also, the patient or the athlete will have some doubt if he'll be ready to go back. Perhaps physically he's ready, but mentally is ready? We don't know. For this reason, to work together is too much important, to share information, and during the meeting, it's good to send emails and to speak during the corridor. But the main thing is to speak together during meetings. This is our key notes, key points is important. My recommendations, that's my recommendation based on my bad experience and my good experience in Aspetar, more than 9 years. Just I have a message for you. Even I had this bad experience, but every bad experience has a good experience. Because of experience, I decided to be a sports psychologist. Because there is personal growth. There is something affecting me negatively, but you have your reaction. What we want to do when we leave something badly and affect your mind and your body and your emotions and the cognitive aspect. Response to injury, my recommendations, I know we are sharing these common recommendations. Develop trust. The first thing, to develop trust, build a relationship, and take care of the patient and treat the patients. Too much important. I know we have this purpose. We are here to treat them. I know you are aware about this kind of concept. But develop trust, it means this is our first plan. You have to speak to his mind. Sorry to say this, and I know that you are informed and you are aware about this. Before to talk with his knee or shoulder. There is special language. Language, it means I need to believe. I need to believe you. I need someone to help me. It's like he's waiting for some hands to go from his home and to go through Aspetar and to go back on his field. Second point, educate the patient and provide him the treatment pathway. It means you have to speak, you have to speak, to educate it. But someone, a patient and athlete, he has experience of trauma. What does it mean? It means if you say something, be sure, perhaps he's not understanding you. How many experiences, he said, I explained this to him. You have to repeat the message. Because he has problem. It means it's like a building and he was affected too much deeply in his mind, in his emotions and cognitive part. And for us, we have to work with him. We have to inform him, but you have to repeat the informations and to show to him you are taking care of him. Education is too much important before, and you know this. Educate the patient, it means to give him all the informations and to say we are with you at any moment. You can come with us. As psychologists, we are working, it means with them, and to say, I want to give him some messages. Be careful, don't compare yourself with others. Don't compare yourself with others. If you need information, please contact professionals. If you see your friend, the same surgery, same date of surgery, and he started, for example, it means to walk a little bit and he still have crutches, don't compare. It's not the same. It means comparison, jealousy, to feel weak, to feel lack of motivation, to trust himself. This is normal. We can say he's not motivated, he's lazy, he doesn't understand, he's stupid. Sure, I'm not saying this, but I want to remind to me first. I'm a psychologist, and I want to share this with you. Second phase, what is my recommendations? Response to rehabilitation, be a good listener. Sincerely, listening is a science. I'm sorry to say this. Even you are professor, even you are the very excellent practitioner, to listen without your knowledge, this is science. Listen, it means it's like you don't have any knowledge. Listen what he's saying, because we have two types of informations. We have physical information, it's clear, and you have hide informations, psychological informations. How many cases, it means you will explain for half hour. In the end, you hear from your colleague, he said what he said to the patient, he didn't understand. It's very strange. No, it's not strange, it's normal. Because we are dealing with special people. We are dealing with special athletes. It means he's thinking a lot about his career. He's listening to you, in the same time, he feels fear. He's speaking with you, and at the same time, he has some doubts. He's speaking with you, and at the same time, he has too much questions. It means we are dealing with too much informations. And how we can deal with too much informations? We have to listen. It doesn't mean I'm surgeon, I'm physician, this is my part of the job, I'm psychologist, I have to hear just my informations related to my expertise. No, I have to understand what happened. Promote Aspetar staff involvement. It means, sure, when you're working with patient, it means, or with athletes, don't keep the patient with you. It means we have too much expertise here. You can do something very good, because when you keep the patient, it will be dependent. Our goal is not to let him to be dependent, to be independent, to feel self-efficacy, to feel that he trusts your treatment, he trusts what you are saying to him, and he trusts himself. He feels that he's in control of his health. To control his health, it means this is a step important to work on it, especially in this period. The last period, response to return to play or termination of career, no blame approach. It's a very sensible period because you have some issues and you have to give some answers. Like my case, I left the hospital. I didn't finish my physiotherapy. And second thing, the screw went through my bone and created internal bleeding. And I was obliged to deal with this hospital for second time to do another surgery. In the end, what is the keynote? Sincerely, the concept is about your experience of treatment. It's not your treatment. The athlete is listening about the experience, bad or good. It means if he has a good experience of treatment, you will decrease his fear to be re-injured again. It means it's like he's going to his home. In the end of this day, every day, I'm working here, but I have to go back to my home because this is safe side. I have to go to my home because I am fine there. And this is our message to send to the patient, that this is also like his home. And this is a psychological message. It means we'll support him. We are here to help you, not just apply on you our experience and expertise. This is just to show to you that we are dealing with many athletes, and each athlete is different from others. Now I want to introduce a new concept. Perhaps you know this. New concept, it means in Aspetar we have medical file. It's true, medical file. What do you think to work on other file? Psychological file. It means profile. What means? It means, sure, we are experts. We have experience. It's something we are dealing daily. I speak with him. I'm polite. I'm listening to him. But there is special language based on science. To work with people, it means to understand what is his profile. Mr. Psychologist, we are talking a lot. This is not my specialty, please. This is something related to you. You have to do your job. You have to work together. It means to understand athletes, it means you have the minimum knowledge how to understand what kind of profile I am dealing with. Everyone has different personalities. You seem to have good relationship with some people and very bad relation with others. You see yourself in a certain way. Others will see yourself differently. You have difficulty to understanding other people's point of view. You have strength in some areas, but struggle in others. You have to recognize this. You have to accept. You have two concepts: acceptance and responsibility. My case, my bad experience, if I go back there, I put my case in the middle of the table. All the practitioners are there. They will say, I think the problem it comes from the patient. He's complaining a lot. Since his surgery, he started to shout, we don't accept this. And he has some problems with the physiotherapist. He wants someone dedicated for him. It's not acceptable. And what happened for me for the second time, the screw went through my bone and created internal bleeding. This is my fault, perhaps. I do some mistakes of movement. I didn't respect the recommendations. It's not true. Who will be responsible of my case? The physiotherapist, the surgeon, physician, me, others? This is question and this kind of questions is in the purpose of our job. Now, when we start to introduce this concept profile, how we can understand people? You have something, please. We have a tool. You have a methodology to help us to understand athletes and to tailor the treatment physically and psychologically. Yes, MBTI is Myers-Briggs Type Indicator is a tool. It's a self-report tool designed to indicate psychology preferences. It means what? It means if you need to understand people, you have to understand yourself first. If you need, as expert, if you say, I want to improve my knowledge, to know people, you have to start by yourself. If you consider yourself that you are the best of the best, you are not be a good listener. You apply your knowledge and experience on people. Khalas, finish. Okay. And after you hear many messages, I work with him, but at all I'm not satisfied with him. He's not listening. I didn't show any emotions on his face. I'm asking too much questions, but he gave me responses, but I don't feel that he's taking care of me. This is the basics of our relationship, the basics, we need to achieve. Self-report instrument, not judgmental, is a way to sort and to measure, not to judge people. And sensory is very easier. Easier, it means, to explain this, it's easier. To define the profile, we need special clinic. It means to sit with the patient, to let him to understand some concept, to explain to him how we can understand himself after he can fill the questionnaire. And when we finish the questionnaire, we have to sit again with him and to talk about his profile. And the question, what do you think? This is you? Yes, I'm me. To define the profile of any person here or outside, you need 4 letters. 1, 2, 3, 4. Yes. The first one, are you extrovert or are you introvert? Why? It's important. How you get your energy? When you are people, you are fine, you get energized, or when you are with people, you are tired. You want to go back to your home. Someone extrovert, it means he likes to be with people, to have ideas. He likes to hear noises. Someone extrovert, if we put him in an office and you close the office and you ask him to do some tasks, he'll be crazy. He wants to go out. And this kind of people, or athletes we are dealing with. Are you introvert? It doesn't mean you are not educated, or you are weak, or you are afraid of people. Introvert is a way how you get your energy. I'm introvert, but based on my experience, I'm dealing with people. I'm doing lectures, workshops. I developed some skills, but basically when I finish my job, I go home. Mainly, I don't like to go out. Mainly, I prefer to stay at home to read books with my family, with my kids. How to define the profile? The 2 first letters. Are you introvert, extrovert? We can do like a small exercise. You have iPhone or mobiles. Put your letter. Are you? You think you are introvert or extrovert? Extrovert is someone. He likes talking and to show himself. He's very happy to be with people. Mainly, when he speaks, he will think after. Introvert, he will think after he will speak. Introvert, he will be a very good observer. Extrovert, he's good observer, but he will have too much experiences. He will speak with everyone. He needs energy to live. For introvert, he needs quiet environment. Quiet environment. Imagine if you have a patient introvert. And under stress, someone introvert under stress will be the opposite. Will like extrovert. Will ask too much questions. He will show that he is not fine. You see that he has too much energy. But in the end, stay a little bit and see what's happened after. When he will feel fine, he will go back to his profile. Introvert. He will come to work with you, but he's not speaking a lot. Just small words. It doesn't mean he don't like you. It doesn't mean he has any problems with you. It means this is inborn characteristic. Inborn. It's not something you learn from university or from anywhere. And your profile will stay with you all your entire life. You will have one profile, no 2 profiles. We are using both. Sometimes now I'm extrovert because this situation pushed me to be extrovert. But mainly I'm introvert. Second letter to define your profile. how you get in information, how you collect information, how you understand the word. You have two letters. You have sensing, it means realistic. You base your orientation of your thoughts on facts. Sensing means realistic. It means you are dealing with patient is realistic. You have to explain everything. 1, 2, 3, and you have to repeat many times. When you feel that he needs to be reassured, you have to do it. And you have a second letter, intuition. It means someone has a general discussion. He likes creativity, philosophy. He's talking. He's creative. When you talk with him on realistic way, he'll be bored. You need to show to him that you understand him. And when you explain some abstraction, you have to be smart. How you transmit this kind of informations. Are you introvert? Are you extrovert? It means you put the first letter, introvert, extrovert, and you pass another letter. You are sensing realistic or you are intuitive. It doesn't mean realistic, you are stupid. And intuitive, you are very creative. It's not, no. This is a way, this is your personal characteristic. This is skills we are using. The third letter, it's about how you take decisions. Very good. In our daily work, you can see some patient sensory is difficult to see any emotions on their face. This kind of athletes is thinkers. Thinkers, it means he prefers to think about objectivity. If you are working in good way, if you are energized by motivation, you are taking care of him. He's looking about steps. What's saying is logic, is not logic. There is sense or no sense what you are saying. Thinker he has this type of orientations. In general, some thinkers is difficult to say to thank you. Too much difficult to say thank you. I will say good job. I want to share with you that you are doing excellent job. And mainly our job with our colleagues based on our relationship. But in the same time, we have different personality. It means what? It means you have some colleagues are feelers and some colleagues are thinkers. When they start to speak together, sometimes there is problems of communications. The thinkers, he will say, he's too much emotional. He's not professional. No, he's not professional. And the feeler will say he's a robot. He's not human being. This is reality. How many times you have this kind of problems with athletes? He's not playing a movie. He is. This is his characteristic. For this reason, we should to have this knowledge and to practice this knowledge in order to help in the right way, psychological right way. Because relationship, as I mentioned, psychology factors are too much important. And how to build relationship, how to talk with him, how to speak with him, it's part of big factor, psychological positive factor. Last letter, it's about judging and perceiving. It means how we will achieve your work. Judging someone is determined. He's planned. He's looking for order. He's too much stress. He wants to start right now. We have a patient. He needs to finish quickly. He needs to do his best. He's challenging others. It means he's determined. He's not bad boy. He's very determined. And are you perceiving? It means you are spontaneous. You want to do your job, but don't put on him stress, please. What do you think? Are you extrovert, introvert? How you take information? Are you sensing? It means realistic or creative, intuition. How you take a decision? Are you a feeler or are you thinker? How you realize? You achieve your goals? Are you determined or you are perceiving flexible? Okay. Perhaps if you started to put your letters, you can see your profile. This is just to summarize the profiles. This is not the right way how to define profiles. I have two cases. The first case is ESFP. This one, 19 years, football player. He's living here in Qatar. ACL athlete. Special profile. What you observe since many long period. This profile has abilities, has potential to be depression with ESFP. Extrovert, realistic, feeler, very sensible and very flexible person. You see his energy, he's happy to be here, he's talking with you. At the same time, he has any problem, he will go down. We have to be careful about this profile. Second case, it's about ESTG. This is player, leader, international athlete. It means how we can deal with him. Okay? It's difficult to convince him sometimes. Sometimes you can attend some session, sometimes he will not come. How we can deal with him? Extrovert, he's expert in communication, very realistic, thinker. In the first instance, he's looking everything, it's good, not good, or doing a job, and determined. He's a fighter. How we can deal with him? ESFP and ESTG. General application. It means the tool is too much important for you. Knowing your profile, understanding yourself, problem solving, stress reaction, what you have stress, how you deal with stress, how you deal with your colleague, with the patient. Knowing your profile and to help patient to go back on the field. Understand and working relationship, communication style. What kind of relationship style I have to keep with this kind of patient? He's not a fighter. He's not bad person. He's not bad person. He's just a leader. He's just a leader. He wants to lead. If in the first second when you start to speak with him and to know yourself, he will have his judgment. He will know how he will deal with you. If he's a leader, it means you have to be careful. Based on this knowledge, we will have this capacity to deal with everyone. And you know your profile, and you can say to yourself, I can do it, or not can do it. I prefer my colleague has strength, has knowledge about his profile. It can be the right health provider. Working in teams and organization. Leadership style, managing change. It means when you know yourself, you know others, it's easier for you to lead your thoughts, to lead your opinion, to share your advices, and managing change if you want to grow up. In the end,
Okay, baby. Okay, two over here. I know. Okay, Miss Norman. Okay. What? Last one, baby. Okay. Oh, no. Oh,
Right. Yeah. Let's do mine. 1, 2, right. Yeah. Let's do mama's. 1, 2, right. Good. All right, now, Daddy's got your arms. Whoa, we don't like this. What's that? A 1, a 2, a right. Good. Yeah. All right. Let's say a 1, a 2, a right. Good. Yeah. Okay. Bend it. It's a bend it. We need tissues. All right. Let's get your Band-Aids. Hold on to that. Good. We'll get your Band-Aids. What's that? Let's get this one on. You're going to take it right off. I know you guys. You take them right off. We'll take this and good. All right. Clean up. Everybody do this here. Clean up.